Yeah. Good morning. This is the meeting we've all been looking forward to for the last year, so it's always a treat, honestly though, Marcy, to have you come and talk to us about our benefits, and there's really not much to say, so I'm just going to turn it right over to Marcy. Yeah.
Okay. Thank you. Good morning, everyone. Thank you for coming out today to learn about your benefits. I'm glad the sandwiches arrived on time. As Jason said, my name is Marcy McRoberts. I'm with GBS Benefits, and we are the broker that works with Kaysville City on your employee benefits. So very happy to be out here again today to walk through the benefits that you will have available for the coming year. Now, open enrollment is your opportunity each year to go in and review the benefits offered by the city, and during this time you can make changes. So if you want to switch between the medical plans that are available, you can do that during this time, add or remove family members, or pick up benefits that you've waived in the past. Essentially, everything opens up to you. Any changes that are discussed in this presentation or changes that you make during open enrollment will go into effect on July 1st. Okay, so we're going to see through the end of June, and then July 1st is when deductibles and those maximums all start over as well. Now, your elections are all made online. If you guys have been here for a few years, you're very familiar with Employee Navigator. You will have an email in your inbox today, right around 10 a.m., that is going to have a link to get started with that process. So that officially starts today, and you have until Thursday the 30th to get your elections made. Very important to take away from this meeting, this is an active enrollment year. That means you must re-elect benefits for the coming year. Things will not simply roll over. So you have to go in there and tell us which plans you want for the coming year. Once open enrollment ends, the only time during the year you are permitted to add or remove dependents or join the benefits or drop benefits is in conjunction with the qualified life event. So things like getting married or divorced or adding a new child to your family. Those are events where you may be adding someone or removing someone. If you have insurance elsewhere and you lose that coverage during the year, that is also a qualifying life event to join the benefits. Just remember, you have 30 days from any of those events to make the appropriate changes. Get with Kim right away. Don't wait beyond the 30 days. If you do so, the carriers do not have to allow that request. So make sure you put a little reminder on your calendar if you have anything like that coming up. One other thing, there's a new additional step you will notice in Employee Navigator this year. You'll sign in using your username and password, which I'm sure everyone has remembered from last year. Don't feel bad, nobody remembers their username and password. There is an opportunity to reset your password, so you can use that, but once you get signed in, it is going to send you a two-step authentication code to that same preferred email that you signed up with. Take those 6 digits, type them in, and then you will get into the system to make your elections. You'll walk through the benefits and either elect or waive each one of the plans, and then remember at the end to submit your elections, you must click on the Click to Sign button. That is your electronic signature. Okay? So, we're not making any changes this year to the plans or the carriers that are offered, but where there will be some changes are to premiums. And like everything else going on right now in our country, medical care costs continue to rise. So we do have some increases to talk about. We have a 16% increase to the medical plans. And then your dental premiums will be increasing by a little over 4%. Now there's one plan design change, and that impacts only the high deductible health plan. And this is an IRS regulation that we're just keeping in pace with. Every year they adjust the minimum deductible to partner with an HSA. So that is going to increase from $1,600 for single, $3,200 for family, to $1,650 single, $3,300 a family. That does not increase your out-of-pocket maximum. So we'll talk about that here shortly. So let's talk about medical first, and you can see we're going to cover a number of benefits available through the city. But your medical plans, you have 2 plans to choose from. Both are with the University of Utah Health Plans. Okay. They're a very large carrier. I mean, you can see here the hospitals and facilities. They have over 1,200 providers statewide and 42 hospitals. This first plan shown is your high deductible health plan. This is the only of the two plans that is eligible to partner with a health savings account. So this plan will cover your preventive care services at 100%. Those are things like your annual exams, child care, immunizations, age-appropriate screenings like a mammogram or a colonoscopy or an eye exam. When you go in, you can have those services done under preventive care. For everything else on this plan, you will notice there's a little AD next to it. That means after deductible. So when you go in to get a prescription after July 1st or go to the doctor's office for an illness, instead of paying a copayment, you are going to pay the cost of that visit. Now, it's appropriate to know that you still get the discounts that are associated with your insurance. So please make sure you are presenting your insurance ID card so they are billing the you. We want to make sure that those discounts are being applied and that those dollar amounts are being applied to your deductible and your out-of-pocket maximum. So if your office visit is $100, that's the allowed amount, that will count towards your deductible. Deductible is $1,650 for single coverage. That means employee only on the plan. If you sign up with one or more dependents, you share a family deductible of $3,300. So a family deductible could be met by one person, let's say in July, who has very large claims. They could meet the full $3,300 for a family. But if that doesn't happen, maybe your family just all incurring claims throughout the year, everyone's claims contribute towards that maximum, okay? So once you hit $3,300 or the $1,650, then you will see that the plan will start to pay 80% towards office visits and hospital services. You would pay 20% for any remaining after deductible amounts. And the same applies to your prescriptions. So everything goes to an 80-20 benefit once the deductible has been satisfied. You would continue to pay your 20% until you have met your out-of-pocket maximum. Think of your out-of-pocket maximum as a financial safety net to you. If you had a catastrophic situation, that is the very most you would be responsible to pay over the course of the plan year. This includes your deductible as well as the 20% you pay after your deductible. So once you've met $3,000 for single coverage or $6,000 for family, all claims for the remainder of that plan year are covered at 100%. Okay? Now you will see here you do have out-of-network benefits, but I do want to caution you to avoid going out-of-network when at all possible. You'll notice the deductibles and out-of-pocket maximums are significantly higher than those in-network, and claims are only covered at 50% after that deductible. So you're going to pay a lot more out of pocket, and you also run the risk of being balance billed. If those providers charge higher than what the U reimburses them based on their fee schedule, you're going to be responsible for those additional amounts, and those balance billing amounts do not count towards your deductible or your out-of-pocket maximum. So stay in network, make sure you are using in-network providers. The second plan is what we refer to as a traditional plan. This plan has more of those predictable co-payments at the doctor's office and at the pharmacy. The same preventive care services are covered at 100%, but on this plan, the only time you would pay a deductible is when you are using hospital services. So that would include any kind of inpatient or outpatient care, major lab and diagnostic work like MRIs, CAT scans, as well as the emergency room. But for everything else, you simply have a copayment. So primary care physicians are a $25 copayment. If you see a specialist, it's a $50 copayment, which is also the copayment for urgent care. And then the mental health for the telehealth is a $25 copayment. Prescriptions you can see down below here. For tier 1 drugs, there's no cost. $10 for the tier 1 generic, $35 for tier 2, and then tier 3 is a 35%, and preferred as specialty is $30. Now there's no deductible attached to those prescriptions. So again, when you go into the pharmacy July 1st, you would pay that appropriate copayment or percentage and not have to meet your deductible. Deductibles on this plan are $1,000 per person. So each family member has their own unique deductible of $1,000 with a maximum of $2,000 for a family. Okay. Once you've met your deductible, Those hospital services are then covered at 80%. You would pay $20, and the emergency room becomes a $250 copayment. Just like the first plan, there is an out-of-pocket maximum. It includes your deductible, any copayments, and your 20%. Once you've met $4,000 for one individual, their claims are then covered at 100% for the remainder of that plan year. And collectively, a family, once you've met $8,000, then you're covered at 100% as well. Same out-of-pocket or out-of-network logic applies here. You'll pay a lot more when you go out-of-network, so stay within the network. I mentioned telemedicine. This is a great benefit. It's something that I think a lot of people forget they have. But if you find that you've got a situation where maybe you're not feeling well, something simple like a migraine or a sinus infection, or you've got a kid who came home with pink eye, using the telemedicine is a really convenient way to get medical care and, if necessary, prescriptions called in on your behalf. You can call in at your lunch break or at home when you're in your pajamas, talk to one of their physicians, and get the help that you need. Now, where you don't want to use this is if you have cut yourself and you're bleeding, don't start with telemedicine. They're going to tell you to go to an urgent care or to a doctor's office of some sort. Use this for non-urgent or emergency situations. But again, it's a great way to get the services that you need conveniently. Again, 24 hours a day, 7 days a week. If you haven't done so already, I'd encourage you to go out and register on the UUHP website. By doing so, you get access to a lot of great information about your health plan. You can look up and see what you've met towards your deductible or your out-of-pocket maximum. You can look up providers right there conveniently on the website. And you can also view your claims, see if you need to print out an explanation of benefit or details for anything. All of that is right there on that member portal. Now, I mentioned that the high deductible health plan is eligible to partner with the health savings account. The HSAs that are available through Kaysville are administered by Health Equity. These are personal bank accounts set up in your name. Both you and the city can put money into your HSA, and then you would use those funds to pay any out-of-pocket medical, dental, vision, or pharmacy expenses. So as you're paying more upfront on that high deductible plan, the money in your HSA is really helpful. You can swipe that debit card and pay for that expense if the money's in your account. Now, down below are 4 rules that the IRS has. These only apply to the employee as you are the owner of the account. So you must be at least 18 years of age, and you must be enrolled in the qualified high deductible plan. You may not be claimed as a dependent on someone else's tax return. And the last one is you cannot have any other health insurance coverage. That last one is where people get a little tripped up. If you have Medicare, even if it's Medicare Part A, you are not eligible for an HSA. If you are double covered, whether it be through a spouse or a parent's plan, you are not eligible for an HSA unless that secondary plan is also a qualified high deductible health plan. If both plans are qualified high deductible plans, then you can be enrolled in both and continue to put money in your HSA. But please think about that. If you know you're questioning whether or not you may have a problem, come visit with me afterwards or talk to Kim, because we want to make sure that you are not doing anything that might upset the IRS. Now, those rules only apply to the employee. They don't apply to your dependents. Spouse can have Medicare, kids can have double coverage, totally fine. Your dependents don't even have to be on your health plan in order for you to use your HSA on their behalf. Just remember, as long as you are eligible to claim them on your taxes, then you are eligible to use your HSA dollars to pay their expenses. Okay? So some of the advantages. When you sign up on that high deductible health plan, you're going to pay a lesser premium. The amount you pay each payroll is lower than on the traditional plan. But the tax benefits that come with an HSA are what make it really an exciting plan. For every dollar you put in, it goes in totally tax-free when you run it through your payroll. So no state, federal, or FICA withheld from those amounts. Any money, interest that you earn throughout the year on these accounts are totally tax-free to you. And then when you spend the money on those qualified expenses, they remain completely tax-free. So I was doing my taxes a couple months ago, and my CPA said that I was better off making sure I fully funded my HSA than even fully funding my 401k. And the logic behind that is these are totally tax-free dollars. Most other retirement accounts, the IRS finds a way to get a piece of that pie, either the money going in or the money coming out. So HSA is truly tax-free. Now you can change the amount you are putting in through your payroll deduction throughout the year. So having that flexibility is really nice. You can increase or decrease. Maybe you find out you're having a surgery or a new prescription, and you may want to put a little more money in there to cover that. You can have that flexibility throughout the year. The funds roll over from year to year as well. So as you're putting money into this account, as is the city, if you're not spending it, that's actually really good. It's just going to continue to grow in your account. And the money, the day it goes into your account, belongs to you. And it belongs to you until you spend it. For some of you, that could be 10, 20 years down the road. Just let that money start growing and accumulating. The best part, of course, is that these are portable accounts. That means if you are no longer on the high deductible health plan or you're no longer working with the city for whatever reason, any money you've accumulated in that HSA is still yours to keep. It goes with you. You can continue to spend it on those qualified expenses until the money is gone. The only thing you could no longer do once you're not on the high deductible health plan is you just could not put more money into the account. Okay, but you never lose what you have in there. And then Health Equity does have a number of investment opportunities. They have a partnership with Fidelity. So once you have an account balance that exceeds $2,000, anything above the $2,000, you are eligible to invest. So by doing that, of course, the hope is to grow that account balance a little more aggressively. If you're like me and the thought of choosing mutual funds or investments is a little intimidating, they have some really nice advisor tools that you can sign up for that they help manage and choose those funds for you based on your risk tolerance. So a great way to grow your HSA. Now, each calendar year, the IRS puts a limit in place. That limit is how much can we put into an HSA. That limit includes anything your employer puts in on your behalf as well. So if you sign up on the high deductible health plan as a single, the most you can put in this year is $4,300. If you sign up with one or more family members, that increases to $8,550. If you are 55 or older or turning 55 this year, you can increase that maximum by $1,000 this year and each year moving forward. Now, you can see here, just by signing up on the high deductible plan, the city's going to put money into your HSA. They generously put $1,000 in during the month of July. So that gets dumped in immediately in July. And then each additional month, you would get $100. Which brings you to a total of up to $2,400. It's up to, because if someone comes on during the year, they may be prorated a little bit. But those of you who are on for a full 12 months, you would get $2,400 from the city. So be sure to subtract that $2,400 from your IRS maximum, and then you can put in the difference. You can also earn an additional $200 by participating in the wellness program. Okay, so those are great ways you can get money put right into your HSA. And then, of course, your contributions would just add to that. If you haven't done so already, I'd encourage you to download the Health Equity app. It's a great place to check your account balance, but it's an even better place to save your receipts. As you spend money out of your HSA, you should be saving your documentation to support that the money you spent was on qualified expenses. Why that's important is at tax time, you will get a statement from Health Equity, and you will include two numbers from that document on your tax return. One is how much did I put into my HSA this year, and the next is how much did I spend. And if you were ever audited on your personal taxes, the IRS could ask you to send in that proof that the money you spent was on qualified expenses. If you've been saving it, it's a lot easier to turn around and give it to them, okay? You can simply open the app, and there's a little upload receipt icon. You can scan your document with your phone, and it puts it right into your banking portal. I mentioned you get a debit card with Health Equity, and then they also have member services available 24/7. Your dental and vision plans, nothing changing here. We are with EMI Health. Your dental plan has no deductible. This is a very rich plan that you have available. You also have the choice of two, oh my goodness, you also have the choice of two networks. You can use either their Advantage Plus network to get the very best benefit and the deepest discounts, or the Premier network. Those are both considered in-network providers. So choose between those two networks. All your preventive care services, when performed within those networks, is covered at 100%. So going in for those annual bite wing x-rays or getting your exams and cleanings, those can be done twice a year. Each person can go in 2 times each year. Those are all considered basic. Those are considered preventive. Then if you need any basic work done, fillings, root canals, oral surgery, those are considered basic, and those are paid at 80%. You would pay 20% of the cost of any basic work. Any major work, crowns, bridges, dentures, or dental implants are covered at 50%. Now, I do want to point out that there is a 6-month waiting period on major. That only applies to new people joining the plan. So if you're joining during open enrollment for the first time, you'd have to be on the plan for a full 6 months before those benefits would start to pay out. Or if you're adding somebody new to your plan this year at open enrollment, maybe a spouse or a child, they'd have that 6 months applied to them as well, okay? But if you've been on the plan and you're simply re-enrolling, you can ignore the 6-month waiting period. Now, those 3 categories, preventive, basic, and major, all count towards an annual maximum benefit. That maximum is how much EMI will pay out towards your dental care throughout the year. So again, from July 1st through June 30th, each family member has a maximum benefit of $2,000. That $2,000, it's a very large maximum, but once they've paid out $2,000, they pay nothing more until the next July 1st. Where you really want to make sure you're watching that is when you are getting that work done in the major category. Some of those treatments are very expensive. Dental implants are very, very expensive. But again, you would receive up to a full $2,000. Then it would start over July 1st. One benefit that does not count towards that maximum is orthodontia. This is available for your dependent children up to the age of 19. It will pay a 50% benefit to a separate lifetime maximum of $1,500 per child. So each family member on the plan can receive up to $1,500 towards their orthodontic care. But again, that one does not start over every year. It is, once they've paid out that benefit, that is the most they will pay out for that child. Similar to your medical plan, you can choose to go out of network for your dental care, but also like the medical plan, you run the risk of balance billing. So EMI will pay them off their reasonable and customary fee schedule. If that dentist charges above and beyond that, you would be responsible for that additional amount. By staying within their 2 networks, you can ensure that you will avoid any surprise billings. Vision plan as well as through EMI. Think of this vision plan as a hardware plan. You're going to get your eye exam done through your medical plans. Both of your medical plans cover your eye exam. So get your eye exam and then take your prescription for any eyewear, contacts, eyeglasses, to an EMI provider. How it works is each family member on the plan gets an allowance. That allowance is $130 either towards the purchase of frames or towards contact lenses. So you choose one or the other. That benefit refreshes every 12 months, so it's based on the date of your purchase. So if you go in on May 20th to get your frames, 12 months from that date, that benefit is available again, okay? Lenses on this plan are a $10 copayment. You can see here, you can go to Costco, Sam's, or Walmart as well, but that allowance does reduce down to $70. And truthfully, that $70 at those locations could be more valuable than $130 at another provider's office. So I do encourage you to compare pricing before making your purchase. And then EMI has discounts on LASIK eye surgery. Now, you can go out of network for vision coverage. If you do so, you will have to pay the full amount at the point of purchase, and then you can turn in a claim form along with your itemized receipt to EMI, and then they will send you a reimbursement for those out of network amounts. Okay, a couple benefits I want to touch on that are through the Guardian. These are voluntary benefits. That means if you would like to sign up for them, it's at your cost, but these are also benefits that pay you money directly when you have a claim. So the best way to describe these plans, I'm sure those of you who watch college football, the Aflac commercials with Deion Sanders and Coach Saban, it's the same thing, but there's no duck, okay? So these work the same. These pay you money. The first one listed here is your accident plans. Accident plans are great because they will pay you if you or your enrolled family member experience any medical care related to an accident. So common things we're going to see are broken bones, lacerations, ER visits, x-rays, things like that. You have two plans to choose between. So what's an accident? Things as easy as falling down the stairs, tripping over your dog, or if you or your family members play any kind of organized sports and you sustain an injury in those sports. What's not an accident? Kidney stones, appendix removal, or going to the ER for stomach pain. Those are medical conditions. We also, I feel like I need to always point out in every meeting, accidental pregnancies do not get paid out by the accident plan either. We get that question at least once a year. So yes, unfortunate or not, but not an accident, okay? So the best way to see how an accident plan works is to see a claims example. So Maddie wrecks her bike, she's taken to the hospital by ambulance, she's fractured her collarbone. So it's important to point out that Maddie is still giving her medical insurance to the hospital, to the ambulance company. Those bills are going to the U. Okay, but then she's also going to request an itemized statement from those providers showing what was performed, and she's turning that into Guardian. Assuming she was on the low plan, you can see her treatment, she would have received a check for $1,650. If she's on the high plan, that increases to $2,375. That money is hers. She can pay her part of the medical bills with it. She might want to replace her bike. She can do anything she wants. That is her money. Okay?
I have a question.
Yes.
How long after you have that accident do you have to file it?
That's a great question. Typically, they want those filed within 12 months.
Okay.
So if you're sitting here today going, I forgot I have this benefit and I had something that I can turn in, get it turned in. In fact, visit my friend Heather in the back right there, and she can help you get the necessary things pulled together to file that. That is true with the next thing I'm going to touch about, which is the wellness benefit that is included in these plans. So if you have accident coverage today, even if you didn't have an accident, you can turn in and receive a wellness benefit. So things as easy as going in for your annual exam, a mammogram, immunizations. You can see there's several more things. And Heather, you have a flyer on these at your table.
I sure do.
Thank you. If you're on the low plan, you can get paid $50 per person per year. So each family member can receive $50 for going in for those preventive screenings. If you're on the high plan, that doubles to $100 a person. So again, if you're going, oh, I forgot all about that, go see Heather. We'll get those filed and get those dollars in your pocket, okay? And you can file those every year. The next plan is critical illness. Critical illness pays you a lump sum amount of either $10,000 or $20,000 if you are diagnosed with a covered critical illness. And just like the accident plan, that money is yours to do with as you wish. If you're dealing with a critical illness, sometimes those may help with those higher medical care costs or costs of living while you're out of work. You can add your spouse for 50% of the amount you've covered yourself for, and dependent children to the age of 26 are covered at 25% of your benefit amount, and there's no extra cost to add your dependent children. So please make sure you're listing all your kids there on your plan. There's also no pre-existing on this plan, and there is an additional wellness benefit. So what is a critical illness? You can see on this slide that there are a number of conditions paying out 100%. Cancer, heart attack, stroke, those are the ones we see the most of. And then there's several others that pay at a reduced benefit. Things as simple as skin cancer pay a $250 benefit. MS, carcinoma in situ, or Alzheimer's all have a benefit payable. Okay? So here's a claims example. David has the $20,000 policy, has a heart attack. He's going to get a check for $20,000 from the guardian. And again, that's money that his family can use as needed, okay? This wellness benefit pays $50 per person per year. So again, if you're having those things done, make sure you're turning in those wellness benefits to get those dollars in your pocket. The last guardian plan is hospital indemnity. This pays you if you are admitted into the hospital for an inpatient stay. It has no pre-existing conditions, and I want to emphasize this last one, no maternity waiting periods. Usually these plans say, oh, you have to be on the plan for at least 10 months before we'll cover a maternity-related hospital stay. That is not true for this plan. That means if you or your family member, your spouse, is expecting a baby and you know you'll be delivering after July 1st, sign up on this plan. You are guaranteed to get paid if you are delivering in the hospital. How it works is you are paid $1,000 for the first day you are admitted into the hospital. This is available 2 times per person per year. Then the plan will pay you $100 for up to 31 days, and that's a per day benefit. And then if your care is in the ICU, that is listed here as well at the $100. So you can see, here's a claims example. Iris is in the hospital for 3 days. She's going to get a check for $1,200. That money's going to help with those hospital bills that are going to be coming in, or maybe for any lost time off work. If her mom's taken off time to stay with her daughter in the hospital, that $1,200 is helpful. One last benefit that is considered voluntary is your ID theft protection. This is through Allstate ID protection. I'm sure all of us at one point or another have been notified of someone compromising an account, or I just had to get a whole new credit card that I was so disappointed because I'd memorized all the numbers and the little security code on the back. I finally had it mastered, and then it got compromised, so I'm starting all over again. But this is obviously a problem across the country, and I feel like the people that are doing these things just get more evolved with how they can compromise our information. So if you want to buy ID theft protection for yourself and your family members, this is a great way to do so. They obviously provide you with credit reports and your score. They monitor your credit. They also monitor the dark web for any of your personal information. They can help with your social media reputation, credit and debit card monitoring, and they have a full remediation service. That means if you are a victim of having your identification stolen or compromised, they are going to take on that responsibility to work on the remediation of that. They also have, if you are financially impacted, they have the means to ensure if they can't get the money back, they have a policy in place that will restore that money for you. They have up to $1 million insurance policy per person. So this is something I encourage you to take a look at, but once you get signed up, it's going to become very valuable the more information you put in. Put all your bank accounts, all your credit cards. If you sign up for this and then you don't take action to add all those things, it's really not working at its full capacity for you. So you will get a welcome packet, and then I would encourage you to put as much information for yourself and your family members into the site. Also, the most impacted population of identity theft are minor children. So these people can use social security numbers of a minor child, and sometimes it doesn't get detected for years. So it's valuable if you're signing up to extend that to your family members as well. Employee only, $9.95 a month. Family is $17.95 a month. If you sign up on the traditional plan, or if you waive medical coverage through the city, you could choose to sign up for a healthcare flexible spending account. This is a way for you to also set aside money pre-tax for those same medical, dental, and vision expenses. You are allowed to set aside up to a maximum of $3,300 for the year. Now, this plan, you want to be a little bit more conservative how you enroll. You want to make sure you are estimating what you think you and your family members are going to spend. So how much at the doctor's office? How much at the dentist office? How much do you pay in prescriptions? Kind of estimate that. You may decide you only need $1,000. That $1,000 would be divided equally over your pay periods, and it comes out of each check pre-tax. What's different about the FSA is you actually could use the full $1,000 if you needed to. If you have eligible expenses, you can turn those into the city. They administer it here in-house, and you could use those dollars. But you want to make sure you're paying attention and using these dollars, because come the end of the year, at the end of the plan year, if you have not spent those dollars and don't have eligible receipts to turn in, it goes to that use it or lose it rule. So again, be conservative in your FSA election, and if you have money in this account today, I would check what your available account balance is to ensure that you get that money spent before the end of the plan year. There's also a limited purpose FSA. This is available to those of you who also have the HSA. It's limited strictly to dental and vision expenses. Now, as a reminder, you can use your HSA for dental and vision, but if you have a year coming up that you know you're going to have higher dental or higher vision expenses, maybe LASIK, maybe kids and braces, or maybe dental implants, you may want to set aside even more money pre-tax to help cover those expenses. This is a great way to do that. I would caution you, however, that if you're planning to use this for LASIK, make sure you're a candidate for LASIK before you make the election. We got a phone call earlier in the year, someone saying, gosh, I put $3,000 in this limited purpose FSA, and now I found out that I'm not a candidate. Well, I hope you can find $3,000 of dental expenses or some other way to spend it, because it's very strict, dental and vision only, okay? Last one here, dependent care. If you pay for child care, you can set aside up to $5,000 annually for dependent care reimbursement. This one works a little different. It does not advance the funds to you. Instead, you can claim what you have contributed year to date. So if you put $250 a paycheck in, you could claim $250 a paycheck coming out. But that is to help cover those out-of-pocket daycare expenses. Again, these elections are not made in Employee Navigator. Those are a separate election. And then you would submit your claims directly through the city. Your life and disability benefits are with Lincoln Financial. Kaysville City insures each of you for $50,000 of basic life insurance and a matching amount of accidental death and dismemberment coverage. They also insure your spouse for $5,000 of life insurance and each dependent child for $2,500. Now, they pay the premium on this, but you name the beneficiary. So remember, that is who would receive the money if something were to happen to you. I cannot emphasize enough how important it is to keep that beneficiary up to date. Last year we got a phone call. Well, one of our HR people got a phone call. Their employee had passed and the spouse called to help figure out the life insurance and everything that comes along with that, only to find out that the ex-spouse was still listed as the beneficiary. And the ex-spouse is who got the check, okay? So it is so important to make sure that you keep that up to date. You can change your beneficiary anytime during the year, so don't overlook that. You can also buy additional life insurance for yourself and your family members. So if you want more than the amount that the city is providing, you are eligible to purchase up to 7 times your annual salary to a $500,000 maximum on yourself. Your spouse can be covered up to 50% of what you have covered yourself for, and kids can get a $10,000 benefit. If you have not yet met your maximum, you can increase your coverage during open enrollment by either $5,000 or $10,000, and that is a guarantee issue, meaning you don't have to answer any health questions or give them any blood or anything to determine if you're eligible. That extends to you and your spouse, and then the full $10,000 is guaranteed on your children. Okay? Disability insurance. This is one of the best benefits an employer can provide because this is insurance on your paycheck. So Kaysville City insures you with long-term disability coverage, which means if you're out of work because of an illness or an injury, after 90 days, this plan will pay you 2/3 of your monthly salary to a maximum of $10,000 a month. This plan will pay until you can either return to work or until you move into Social Security benefits. So really nice benefit. I always call that my sleep insurance. It lets me know that if something serious happened, at least I have that protection and won't lose 100% of my income. Lastly, I want to remind you of the employee assistance program that's available through Blomquist Hale. Even if you waive all the other benefits offered by the city, you have access to this benefit, and this extends to your family members. This gives you access to counseling services at no cost. So whether you need some help individually, or maybe you and your spouse need some mediation with your relationship, or if you've got a teenager that needs to talk to someone outside of mom and dad, they have the right professionals they can match you with. They can also help with a number of other great resources that they have available, including crisis intervention. They also have a crisis hotline 24/7. So no matter what time of day or night you're feeling that you're in a crisis and maybe you need to talk to someone, pick up the phone and call Blomquist Hale. Someone will talk you through that situation, and then they can work to meet with you ongoing. They can do face-to-face, in-person meetings, or they can do that through a virtual setting, whatever your preference is. But this is a great benefit, and this is one that we really want people using. So please remember you have this. Again, no cost to you, and this is completely confidential. So nothing is ever shared back with the city as to who is using this benefit. Okay? All right. So as a reminder, you will all have, in 5 minutes, an email in your inbox from Employee Navigator. When you log in there, please make sure all your personal information is correct. Those addresses are what we share with the insurance companies. That's where they send all their communication to you. And if it's outdated, it's going to create some headaches for you. So make sure we have all your dependents and triple check those beneficiaries. The new benefits, of course, will start on July 1st. New cards would only be necessary if you're signing up for the first time or making changes. And with that, I'll take any questions that you may have. And Brittany's going to bring up the tickets, and we're going to... Oh, did you want to say something, Kim? Oh, okay. Kim just said when you make your election for HSA in Employee Navigator, put a 0. They're going to handle your HSA elections through a different election process. So you will be prompted for an HSA election. Please put in 0. Okay? All right, let's see what we've got here. Oh, this is nice. Okay, a really nice cooler. Who'd this come from? EMI? Nice, thanks, Jill. Okay, so a cooler is going to Parker Brower.